Today's video is regarding Zentel Tablets, which is used for treating infections in the stomach and intestines, caused by various types of worms. In this video we will discuss how Zentel works, its uses, dose, how to use, and its possible side effects. Parasitic worms adhere to the lining of your intestines, where they begin to feed and absorb nutrients from the food you consume. This can lead to slow growth or weakness in both children and adults. Additionally, these worms may pass through the anal canal, causing itchiness, and they may also be passed on to your feces. Zentel, which contains albendazole as its active ingredient, deprive these worms from their glucose and energy source, thus killing these worms. Let's see how to use this medicine. Take the tablet with a glass of water. For all worms. The dose for adults and children over 2 years of age. Take 1 tablet, which is 400 milligrams. For children above 2 years who cannot take tablets, you can give them by crushing the tablet or giving Zentel suspension, the dose of which is 10 milliliters, 1 time only. Dose for children 1 to 2 years of age. Use Zentel suspension by giving 5 milliliters, 1 dose only. Repeat the same dose after 2 to 3 weeks, because sometimes eggs of the worms may still be present in the intestines. So to completely eradicate them, it's advisable to take the second dose. For all other cases, dose is different, which your doctor will suggest according to your condition. Take measures of hygiene, also treat the relatives and individuals sharing the same housing. Zentel tablet must not be used during pregnancy. It has the potential to harm the unborn baby. Side effects of Zentel tablet include headache, feeling dizzy, stomach pain, nausea, vomiting, fever. If you have any question or suggestion, just drop below, we will answer that.